We at Repromed are proud to offer pre-implantation genetic screening, or PGS. This is a technique where we actually check to see whether an embryo is genetically normal before returning it to the uterus. It's a very useful technique for maximising pregnancy rates in women who are experiencing infertility or recurrent miscarriage, or have had a lot of unsuccessful IVF in the past. Of course, you can only get a good pregnancy if the embryo is actually genetically normal, and so this technique allows us to make sure we get that best embryo back, which gives the woman the best chance of success. Research tells us that even though an embryo can look beautiful, a lovely blastocyst, at least half of these are actually genetically abnormal. So the only way of ensuring that a woman has a normal embryo returned is to actually biopsy it and genetically test it using PGS technology. A PGS cycle of IVF is very similar to a normal cycle of IVF for the patient. Basically, she undergoes an IVF cycle where we retrieve the eggs and then we fertilise them using ICSI. And then there's a three-step process. There's first of all the biopsy of the embryo, and then there's the freezing of the embryo, and then the subsequent screening. Embryos are cultured until day 4 or 5, when they're assessed to check if suitable for the biopsy process. This is important as not all embryos will be suitable for the biopsy. To perform the biopsy, a laser is used to create an opening in the embryo, and then 1 to 3 cells are removed. As it takes several days to get the results of PGS, it's necessary to freeze all the embryos and the biopsy cells after the biopsy, with the actual screening performed around a week after, with the results provided to you and a plan of action put in place regarding transfer of any embryos which have the correct number of chromosomes. The biopsy procedure is considered a safe procedure, and all the screening is performed on site at our Dulwich clinic. Repromed is the only IVF clinic in South Australia that actually does pre-implantation genetic screening in-house. And by that, we have total control over the quality, reliability of the screening, and we also have in-house scientific expertise that can discuss all issues related to the PGS process with the patient directly. We've recently reviewed our fees associated with pre-implantation genetic screening, and now it's even more affordable. So I suggest that you make contact with us on 8333 8111 to discuss PGS. By screening the embryos to check that they have the right number of chromosomes, we are not only maximising your chance of having a successful pregnancy from your first cycle of IVF, but also reducing your chance of the heartache of miscarriage.